Welcome to Babies and Bones. I'm Dr. Kate.
And I'm Dr. Nima. And today we're going to talk about postpartum depression symptoms.
So this is a topic that's pretty near and dear to my heart, both as a pediatrician and as a mother of two. Postpartum depression is extremely common and something that no one should ever feel ashamed of. And so as a pediatrician who sees moms with their babies both in the hospital and then at the 2 or 3 day period and then at the 2-week visit and then at the 1 month visit, it's really important to me to be screening for postpartum depression with these mothers in an effort to help take care of the baby and the entire family unit. So we wanted to talk a little bit about postpartum depression symptoms today and the difference between that and baby blues.
Yeah, it's super important for us to make sure that moms know that there's no shame in having any depression symptoms, and that the most important thing for a healthy baby is a healthy mother. And we want to make sure all the significant others watching this video can pick up on cues about postpartum depression, so that way they can help make sure that the mom is safe and seeks medical attention if she needs it.
Perfect. So first we'll talk about what is postpartum depression. So after childbirth, a mother can develop a change in her mood, which includes extreme sadness, anxiety, exhaustion, and unnecessarily blaming herself for things that go wrong with the baby.
And that can be very common. I mean, my wife blamed herself all the time for anything that wasn't going right. And I think that sometimes is just moms being great moms.
Yeah, and just being attentive, but this is kind of going a little bit overboard or to an extreme.
Exactly.
So a big thing for postpartum depression is to know that it doesn't have to be 2 weeks after you have the baby where you start feeling all these symptoms. You could be 3 months out, 4 months out, and then start feeling all these postpartum depression symptoms. And so it even goes more into the question of what causes this.
So it's important to know that there's no single cause, but there are several contributing factors. One of the most important is hormonal changes. Obviously, you just had a baby and there's a major shift in your hormones. The second is fatigue, sleep deprivation. And we all know that after you have a baby, you're not sleeping very well. So these things can be contributing factors to lead to postpartum depression.
Right. So I tell all my patients and my mothers, if you didn't even have a baby, right? So if you never were pregnant, you never had a baby, but you were sleeping in 2 to 3 hour increments at nighttime, you would feel terrible. You would be irritable. You'd probably be anxious. You'd probably have a lack of interest in activities of things you wanted to do because you'd be exhausted. And then add having all these hormonal changes, having a newborn baby, having the baseline anxiety of loving something so much in your entire life that you almost feel crippled by the anxiety. If you add all those things together and then on top of it, you're not sleeping, it's a setup. It's a setup for anyone to feel pretty terrible.
Yeah. Which is a perfect segue onto discussing the actual postpartum depression symptoms. So what symptoms should spouses and family members and new moms themselves be looking for in terms of postpartum depression? One of the common ones is extreme sadness. So obviously you just had a baby and you have hormonal changes. You could be sad. That's not abnormal. But extreme sadness, something that makes it so hard for you to find any joy in anything you do.
Yeah, that's a big one, like a lack of interest in activities that you previously enjoyed. So going for a walk, going to the gym, having a cup of tea, reading a good book. If all of a sudden you don't want to do any of those things, then that can be a problem.
Or if you're overly anxious, you're worried all the time about everything. Again, that's something that normal moms may have anyway. But if it just seems like it's more than usual, that's something that your spouse can look for.
Right. Crying for no reason. I think I definitely had a little bit of this. I remember sitting in a chair and crying, and Nima would say, "Kate, what's wrong?" And I was like, "I don't know," or everything. You just kind of cry. So if this is happening a lot, more than like 2 or 3 times a day, then I would say that would be a definite sign that you'd want to, talk to your doctor about.
Or if you're irritable. Being irritable can be normal. You're not sleeping much. But if you're more irritable than you normally would be, and your spouse can pick up this cue because they know how you normally treat them, and all of a sudden things are a big deal that aren't usually, they should be paying attention for some of these other symptoms.
Sure. Restlessness or sleep disturbances. So sleeping a lot more than normally you would, especially with a newborn baby, sleeping a lot less. So not being able to sleep, say, for an entire night at all, that would be really concerning. Kind of like a baseline restlessness where you're never really comfortable. You kind of always feel on edge. Those are some symptoms.
Or eating more or less. All of a sudden you're not eating at all, or you're overeating because you're finding some comfort in food. if those things are happening and there's a dramatic change in your eating habits, that could be another sign or symptom.
Right. A lack of interest in hanging out with friends and family, that's a big one. So kind of this avoidance of people.
Yeah.
Family wants to come over, they want to help out, they want to help with the baby, they want to be supportive, and you're kind of giving them all the cold shoulder. Friends, once, visitors are cleared by your pediatrician to come over and be with the baby, you're kind of pushing them away as well. Those are some signs.
Or a really big one is if you're having trouble forming an attachment with this baby that you love so much. If all of a sudden you don't want to spend time with the baby, you don't want to
hold the baby, nurse the baby.
Yeah.
You just have no interest in kind of touching the child, picking them up, rocking the baby to sleep. If there's just kind of an avoidance of wanting to be close to the baby, that could be a definite sign. And then a more obvious one, if you want to harm the baby or if you want to harm yourself.
That's a really important one.
Really important. You should reach out to your doctor immediately.
Mm-hmm. So obviously we just named all these symptoms: extreme sadness, overly anxious, crying often for no reason, being irritable, restless, sleep disturbances, lack of interest, eating more or less, avoiding friends and family, and the trouble forming attachments with your new baby or thinking of harming yourself or the baby. And we went through all these, and a lot of those can happen to any mom.
I was gonna say, I think I checked off all those boxes at least some point in the first 4 to 6 months of having a child.
With the exception of the last two, most moms experience just about all of those. So what makes this different? How do you know you have postpartum depression symptoms versus just normal baby blues is the term we use? Because most moms, after they first have a baby, can experience a lot of these symptoms. So how do we differentiate between the two? So the best way to differentiate between the two is that baby blues is usually something that happens for a few weeks and kind of goes away. Postpartum depression, however, can last weeks to months to even years. And even more importantly, baby blues doesn't usually interfere with your ability to take care of yourself or the baby. However, in postpartum depression, if you'll notice, or not, you may not notice, but your spouse or your family members may notice, it's actually, these symptoms are affecting your ability to take care of yourself and the baby. And it's important for a healthy mom to be very healthy to take care of a baby and keep a baby healthy. So if that's happening, that's a big deal. Someone needs to notice this and say something, whether it's your spouse or family members. They need to have you see a medical professional so you can seek treatment. So what would be treatment, Kate? What would we do for treatment?
So treatment for postpartum depression, it's mostly counseling and therapy. So even just talking about these things with other mothers or with a medical professional, that in itself is therapeutic. And then if necessary, there are medications that can be prescribed as well.
Absolutely. Let's do a take-home message because there's a lot that we just went over. If you wanted moms, you were obviously a mom, you're a pediatrician, and in your experience, what do you want moms to really understand about this video and their spouses specifically? Because sometimes moms may not know what's going on, and it's up to their spouses to pick this up. What do you want them to know?
Or any of their partners.
Yeah.
I think the big thing is just that it's really common. It's not something to be ashamed of. You would be shocked by the number of people that go through either some serious baby blues or postpartum depression, that you can reach out to your pediatrician because they might be one of the medical professionals that you're seeing the most frequently in the beginning. And knowing it's okay to be a little bit of sad. I remember talking to Nima, it's okay to mourn kind of this past life that you had. So before you have a child, you can go to the movies on, whatever night you want. You could take a weekend vacation. You can kind of go out to dinner. There's not a lot of planning. And then once you have this baby, you're a little bit more limited in what you can do. Your freedom is limited. Mm-hmm. And it's okay to be sad about that. You have something else that you're so happy about. And so it's kind of a balance, but it's okay to have those feelings of sadness. So I think that's one of the big things I want to get across to women is that it's okay to feel this way. And you can have a lot of these symptoms without having postpartum depression, but being able to identify postpartum depression symptoms and kind of go over and understand when there's a problem and when you need to seek medical professional help is really helpful.
And so from a spouse's perspective, like what I would be looking for is an extreme of any of these symptoms and a change in normal behavior to an extreme, as well as the key thing again is the inability to take care of the child or yourself because of these symptoms. You're not able to actually care for your child and yourself, and the health of either of you is being affected. That is just, I can't drive that point home enough. That's the main thing from my perspective.
Yeah.
Finally,
there's also the Edinburgh Postnatal Depression Scale. So this is something that we'll have a link to on our video, but also you can go online, you can look it up, you can ask your medical professional for one of these. It's a screening tool that that medical professionals will use to identify postpartum depression. And it's a couple of different questions, and you can talk to your doctor about that as well. It's just another screening tool that can be helpful.
So thanks for tuning in, guys. Hopefully we provided some information to help you all in this process of having a newborn. And if we left out anything or things that you felt should have been addressed, please let us know in the comments, and we'll make sure to keep them in mind next time.
Yep. Thanks for listening.
If you enjoyed this video, don't forget to like, comment, and of course, subscribe.